When I last gave birth in 2021, a nurse appeared at the bedside with a syringe and a glass vial. She announced that it was time for my newborn son to have a vitamin K injection. I informed her that the injection would not be necessary and was met with a very concerned look on her face. She said that newborns are at risk of bleeding, including hemorrhages, that can result in permanent brain damage or death. Furthermore, the injection was a safe and effective way to prevent bleeding. Once again, I declined the offer and reassured her that my baby would be fine. In this video, I'll explain why I made that choice and what all parents need to know about vitamin K injections in newborns. Before I get into the main part of this presentation, I need to mention some important caveats. This presentation is focused on newborns being given vitamin K supplementation, typically in the form of an intramuscular injection, as it is claimed that it improves outcomes, saves lives, and comes with no risk. In other words, the routine administration of the injections is an alleged prophylactic measure to all newborns. Please bear in mind, there may be medical emergencies in which it is suggested that you or a loved one is given a vitamin K injection. Those circumstances are in a different category and need to be considered on a case-by-case basis. Another related complication caused by the medical system is early umbilical cord clamping after birth. Although not the focus of this video, we will say that early cord clamping is a dangerous intervention and can compromise both the newborn's blood and their subsequent health. On to the main part of this presentation, and let's start with the typical fear-based vitamin K narrative that is pushed by the medical establishment.
It's been the standard of care since the 1960s. In the first few hours of life, babies get an injection of vitamin K. It's critical for all of us, helping blood clot and bones form.
For newborn babies, it doesn't cross the placenta very well, so they are born relatively deficient in vitamin K.
So the only way newborns can get vitamin K is through an injection, but a growing number of parents are unknowingly opting out of it.
Vitamin K seems to be getting lumped in with other types of shots, usually when parents are referring to vaccines. And so with this increased rise of vaccine refusal, we're seeing accidental increased rise of vitamin K refusal as well.
And the results can be devastating. Dr. Karen Cases treated a 10-week-old at Nationwide Children's Hospital with very subtle symptoms. He was fussier than normal and had small flecks of blood in his diaper.
We noticed the baby was really pale, and we did some blood work and found out that the baby was actually bleeding internally into its brain.
All because he didn't get a vitamin K shot at birth, a case similar to 4 others in Tennessee. Cases is calling on parents to make sure their babies get the shot and healthcare providers to find out up front if they didn't.
Babies can present with such vague symptoms that unless emergency providers were aware that this was happening, they might forget to ask and they might go down the wrong diagnostic workup.
Luckily, in the case at Nationwide Children's, a vitamin K shot quickly cured the patient, but doctors say getting the shot in the first place could have prevented a near tragedy. At Nationwide Children's Hospital, this is Clark Powell reporting.
I hope by the end of this video that you will appreciate the reckless fear-mongering and inappropriate advice that appeared in this Nationwide Children's Hospital advert. Unfortunately, the misinformation campaigns have been heavily propagated in the literature, so when we ask an internet browser and its AI software about vitamin K at birth, a typical response draws on the mainstream sources and sounds like this. Babies are born with low levels of vitamin K because only minimal amounts cross the placenta from the mother, and their gut lacks the bacteria needed to produce it. Breast milk contains low levels of vitamin K, and although formula has added vitamin K, newborns still have low levels for several days. Without sufficient vitamin K, babies are at risk of developing vitamin K deficiency bleeding, VKDB, a rare but serious condition that can cause bleeding in the brain, leading to brain damage or death. VKDB can occur in the early, classic, or late onset periods up to 6 months of age. To prevent VKDB, health authorities recommend that all newborns receive a vitamin K supplement shortly after birth. The most effective method is a single intramuscular injection of vitamin K typically administered within 6 hours of birth. This injection provides long-lasting protection and is especially recommended for premature or unwell babies, those with feeding difficulties, or those born via assisted delivery. The vitamin K injection has been used safely for over 60 years with no evidence of harm, including no proven link to childhood cancer. When I was trained in allopathic medicine and started work as a doctor, this was a story that we generally accepted and believed. But as the disclaimer reads at the end of the AI-generated answer, we need to verify critical facts. By the time I gave birth to my third child, I had done my own fact-checking and rejected the vitamin K injection outright. Let me explain why. There is a lot to dissect with the AI-generated response, and while it can be shown to be misleading, it also introduces most of the key aspects of this issue. We are informed that vitamin K deficiency bleeding is a rare but serious condition. It certainly can be serious, but an important caveat here is that the condition is rare. However, when we consult the CDC webpage about vitamin K deficiency bleeding, it states that early and classical VKDB are more common, occurring in 1 in 60 to 1 in 250 newborns, although the risk is much higher for early VKDB among those infants whose mothers used certain medications during the pregnancy. 1 in 60 would not be very rare, and the CDC provides no citations that can be checked. To clarify the definitions here, early bleeding is defined as that which occurs in the first 24 hours after birth and is usually a result of pharmaceuticals that the mother has taken. It is not helped by the vitamin K injection, so should not be considered as part of this conversation. Thus, the CDC's page is misleading because the vast majority of babies referred to must have the so-called classical form, that is, occurring from 2 days to 1 week after birth. Of these, most would have minor symptoms such as bruising or only blood test, quote, abnormalities. So the CDC information could inappropriately scare people as they have conflated more common trivial conditions with rare, life-threatening ones. The dangerous condition of what is termed late onset bleeding occurs from 1 week to 6 months after birth. It is associated with bleeding in the brain in about 50% of cases and comes with high fatality rates. But this condition is extremely rare. Indeed, when we see an actual published study, like this West German one between 1980 and 1990, it states that the incidence of late onset bleeding in babies not given vitamin K was 5.13 per 100,000 births. Similarly, an Australian study between 1993 and 2017 looked at all forms of so-called vitamin K deficiency bleeding and found an overall incidence of 0.84 per 100,000 live births. Now, this second study included all children, regardless of whether they received vitamin K or not, but again confirmed the very rare incidence. So when the CDC states that bleeding affects up to 1 in 60 newborns, it will almost certainly convince most parents that their child could be at risk of significant illness or even death. However, if someone was warning you about a 0.005% chance of some specific and serious event happening to your child, you would rightfully be skeptical. You would be much wiser to pay attention to vaccines, aluminium-laced milk formula, accidents, poisoning, drowning, asthma, and obesity as being far more significant threats to your child's health and life. However, vitamin K promoters might counter this and say, well, what's a single shot at birth if it could save your child's life? There are many problems with this claim, and the Australian experience is useful to appreciate why. The study concluded that 6 deaths were reported, all from intracranial hemorrhage in infants with late VKDB. While nobody would downplay the tragedy of any death, 6 deaths over a 25-year period in a country the size of Australia is not a lot, and is an average of 1 death every 4 years. To put it in perspective, this is a country that has around 1,200 road traffic deaths each year, and even 32 deaths related to animals each year. The next sentence in the Australian study states that of the 6 deaths, 3 of these infants were delivered at home, were not given vitamin K due to parental refusal and were exclusively breastfed. They appear to be portraying these things negatively, which is perhaps not surprising, as the Australian Department of Health funded the paper with support by the medical establishment. However, it means that half the deaths were infants who did receive vitamin K injections. Indeed, the paper then states the remaining 3 were delivered in hospital and received intramuscular prophylaxis. There are further problems with the study in that it was observational in nature, so it could only raise a hypothesis about vitamin K injections rather than test the hypothesis that they are beneficial. In the study, it reads as if home birth and parental refusal of the injection are risks, but that is misleading for a start. Refusal of the injection does not create a separate independent variable when analysing whether the baby got the injection or not. Furthermore, parental refusal and home birth tell us nothing about all the other factors that determine the health of a mother and her baby. Pregnant women who take drugs, including antibiotics, and those with malabsorption problems or very poor diets are at particular risk in this domain. So it is obvious that a wide range of problems in the mother can permeate as problems in the baby. Remember that our AI friend said that vitamin K supplementation is, quote, especially recommended for premature or unwell babies, those with feeding difficulties, or those born via assisted delivery. In reality, there is no evidence that the routine administration of vitamin K is going to save any lives overall. Keep in mind they cannot claim that the 3 babies who died without vitamin K would have been saved if they had received the injection. However, this is usually implied in most of the mainstream literature on this topic. As a little segue, when we were doctors in the system, the only time we saw vitamin K injections possibly save anyone was in iatrogenic cases, that is, cases caused by doctors themselves. Typically, this involved older patients, not children, having their blood thinned excessively by a pharmaceutical such as warfarin. Sometimes it was simply because someone on blood thinners was simultaneously given a course of antibiotics or steroids. In these cases, the person is at risk of a catastrophic bleed, and the vitamin K injection can rapidly reverse the situation. Clearly, this is not something that can be translated to the injections being useful as a prophylactic in newborns. The reason I bring this up is that it does leave room for the investigation of vitamin K injections in cases where the medical system has already intervened in the pregnancy with pharmaceuticals, or there is serious medical compromise. However, healthy women have no reason to be considering a vitamin K injection for their newborn. In fact, seemingly most unhealthy women do not need to consider it either, given the extremely rare incidence of serious bleeding problems in babies. The incidence is so rare that it's essentially impossible to test the hypothesis with an interventional study, and we'll get to that in a minute. But the last thing I want to cover in the 25-year Australian study is the statement that no adverse effects following vitamin K administration were reported during the study period. This is a spurious remark, as the study was report-based only and did not involve long-term follow-up. The next paper of interest is from the Cochrane collaboration, and it was published in the year 2000. If we read the author's conclusions, they state that a single dose, 1 milligram of intramuscular vitamin K after birth is effective in the prevention of classic hemorrhagic disease of the newborn. However, when we get into the full report, there is an important admission in the form of there have been several trials done on this topic. Practically, all of them measured surrogate outcomes. In other words, they did not record actual illness or death in the children, but instead looked at blood test results. This is highly problematic as parents are interested in the health and survival of their child, not a lab result. The authors explain that the surrogate markers are used because of, quote, the low incidence of vitamin K deficiency bleeding in neonates and infants. Indeed, as we saw in the epidemiological studies, the incidence is extremely low. That is why the authors have to concede hemorrhagic disease of the newborn is rare, and to acquire significant results, the sample size of a randomized controlled trial would have to be extremely large, up to 500,000 participants, making the likelihood of such a trial ever being done seem extremely remote. In summarising the available data, the authors concluded, we retrieved 2 types of trial from the search. 2 trials dealt with clinical outcomes, but mostly the trials dealt with surrogate biochemical outcomes. Overall, methodological quality was poor. Randomization procedures were often not described or inappropriate, and loss to follow-up was high. It was also admitted that a subsequent search for studies that relate these laboratory measurements to subsequent clinical outcomes produced no relevant studies. In summary, there is no good evidence for the administration of vitamin K, and quote, improved surrogate blood test results cannot be used as evidence either. It's not looking good for the vitamin K proponents, but have there been any advances on the Cochrane publication from 2000? Yes. In 2016, a team performed another systematic review and concluded that, given the high risk of mortality and morbidity in infants with late VKDB, it seems appropriate to administer intramuscular vitamin K prophylaxis to all neonates at birth. Despite this bold recommendation, it was admitted that this review has major limitations. First, we did not evaluate the safety of the intervention. Second, the evidence for an effect on late VKDB is available only from surveillance studies. What also caught our attention in this paper was the statement that the numbers needed to treat to prevent 1 additional case of major clinical bleeding in infancy due to vitamin K deficiency would be 1,275. Now that is a horrendously high number, even on their own terms, because it means that 1,275 babies need to be injected to prevent 1 adverse outcome. However, that figure would also be inconsistent with the rarity of this problem, and it is apparent that the authors got this number by, quote, assuming the control risk to be 80 per 100,000 live births. Wait a minute, that is over 10 times the incidence we saw in the earlier epidemiological studies. What they have done here is picked the incidence from poor countries where malnutrition and severe health compromise are much more common in pregnant women. In developed countries, the numbers needed to treat are going to go up to around 15,000. As I mentioned earlier, if the doctor said that they need to inject 15,000 babies in order to prevent 1 adverse event, parents could see what a scam this is. Keep in mind, it is not 15,000 injections to even save 1 life, but to prevent 1 serious bleeding event. But it gets worse. First, it bundles all mothers and babies into the same category, so they all receive the same intervention. This is clearly inappropriate, as the vast majority of babies are at no risk of adverse bleeding, and there are identifiable risk factors in the mother and baby for this very rare condition. Second, as the 2016 systematic review admitted, the safety of the injections has never been properly established, only inferred and assumed. So the question must be asked, for every 15,000 or even 1,275 babies that are injected, how many are being damaged by an intervention that is completely unnecessary for them? From our perspective, the vitamin K issue is an invention of the allopathic medical system. Most newborns are not deficient in vitamin K, as has been claimed. On the contrary, their levels are normal for that stage of life. Does it sound plausible that nature produces infinitely complex miracles like a child, but couldn't work out what to do about vitamin K? Are we supposed to believe that the only way for us to solve it was the invention of vitamin K injections last century? Pregnant women in reasonable health who are not taking drugs should not be scared and guilt-tripped into allowing their newborn to have a vitamin K injection. The best thing any pregnant or nursing mother can do is take care of their own health, and a large part of this is achieved through dietary choices. In this regard, the Weston A. Price Foundation has some great resources, and I'll put a link in the description. As a mother, a medically trained doctor, and a professional researcher, that is why I declined a vitamin K injection into my perfectly healthy child. If you enjoyed this video, please visit supportdrsam.com.